I would say I got the call around 9 p.m., was able to be at the hospital, I think about 9:45. Luckily, we both live close by. The page went out to the nurses that we needed to open the unit, and we were able to accept the patient around 11:30 p.m.
Then I got a call from Sarah Wilkerson, our infection control manager, telling me that we had an incoming case of coronavirus and how we should handle it.
Having the very first patient in our hospital, it is a little, scary. It's something new.
We will wear just standard rubber gloves, and we have a fluid impermeable gown that we'll put on.
In this particular patient, we weren't sure about the degree of contagiousness. We certainly did not want it to spread, so we used the highest level of protection that we have available to treat this patient, as one would Ebola.
The nurse will put it on her head. And then we have the plastic machinery that fits around.
What we know so far is that they believe that it's spread potentially through droplets when you breathe or cough or anything like that, as well as contact, so actually direct contact with the patient or the surfaces that may be contaminated.
And then the patient himself is in a separate, they call it negative air pressure room.
Well, I would again refer to the CDC's recommendations, but if there's a concern that you're symptomatic and you know that you either traveled to an area of concern or had exposure to somebody with a known disease, contacting your healthcare provider, let them know over the phone that you have a concern prior to going in so that they can make sure that they can safely prepare for your arrival.